Okay, so picture this. You're in the ER,
Oh,
and it is chaos. Like, every second counts, right?
yeah,
And the doctors and nurses are amazing, but they're human, right? They're doing their best, but still human.
right.
What if I told you there's this AI out there, and it's already helping hospitals
Right.
predict medical emergencies before they even happen?
It really does sound like something out of science fiction, doesn't it?
Right.
But this is actually happening right now
Yeah.
at St. Michael's Hospital in Toronto.
Mm-hmm.
They're using this AI system called ChartWatch,
Okay.
and it's having a pretty remarkable impact.
So we've got this CBC article on ChartWatch.
Yeah.
And I've got to be honest, even I'm a little bit skeptical.
Mm-hmm.
So how can a computer predict something
Right.
as unpredictable as a medical emergency?
Well, think about it this way. Hospitals are collecting tons and tons and tons of data on their patients every single day.
Yeah.
Vital signs,
Yeah,
blood test results, all of it.
it's true.
What ChartWatch does is it analyzes over 100 of these data points every hour.
Wow.
And it's looking for those really subtle patterns and changes that even the most experienced doctor might miss in a mountain of information.
So it's like having a second set of eyes on every patient 24/7.
Yeah.
But these eyes can process information like lightning fast.
Exactly.
But hospitals have always collected this kind of data, right?
They have.
So what makes this so revolutionary?
The key difference here is the volume and the complexity of the data that ChartWatch can actually handle.
Okay.
Humans are incredible at pattern recognition,
Yeah.
but we simply cannot compete with the speed and scale that AI can, especially in a high-pressure environment like a hospital.
Yeah, that makes a lot of sense.
Yeah.
Okay, so I'm starting to see how this could be a game changer. But let's talk results here.
Yeah.
The article mentions a 26% decrease in unexpected deaths.
It's true.
Is that even possible?
Yeah, it's true. It's an absolutely staggering figure in the medical field. To put that in perspective,
Yeah.
imagine if we could reduce car accidents by that much.
Right.
It would be monumental.
Yeah.
And this is just from one hospital using ChartWatch.
Wow, 26%. That's incredible.
Yeah.
Are you telling me that this AI is like a superhero in a computer?
What?
But how does it actually work? Like,
no.
in a real-life situation? Give me the details.
Well, the article gives a really fascinating example of a patient who came in with what seemed like an ordinary cat bite.
Okay, cat bites. I'm listening.
Yeah.
Everyone knows this can get pretty nasty.
Yeah.
But how does this tie back to ChartWatch, like saving lives?
Well, that's the thing. This particular case,
Yeah.
it didn't seem that out of the ordinary at first.
Okay.
But while a human doctor might just see a minor wound,
Right.
ChartWatch is analyzing blood work vital signs. Even things like how quickly the patient's responding to questions, constantly comparing it to their baseline,
Wow.
looking for those subtle changes.
So it's like ChartWatch is piecing together this puzzle,
Yes.
but instead of like cardboard pieces, it's these little like tiny bits of medical data
That's
that
good.
could point to something more serious brewing.
Exactly. And in this case, ChartWatch flagged some really subtle but crucial changes
Yeah.
in the patient's blood work, hours earlier than a human doctor likely would have noticed.
Hold on, hours earlier.
Hours earlier.
That's a huge lead time when you're talking about infections.
It's huge, absolutely.
Right.
Those early hours can be the difference between a course of antibiotics
Yeah.
and a life or death situation.
Wow. Okay, this is where it clicks for me.
Yeah.
So ChartWatch isn't replacing doctors.
No.
It's giving them this incredible tool to make faster, more informed decisions.
Exactly.
That can actually like save lives.
It's like having this tireless assistant in the room with you
Oh.
who's never going to miss a detail and ensures that even the most subtle changes
Yeah.
in a patient's condition are caught and addressed right away.
That's incredible.
Yeah.
Okay, so this one cat bite story
Yeah.
really paints this vivid picture of how powerful this technology could be.
It does.
But we're still just talking about one hospital in Canada.
Right.
What happens when you take this kind of AI and you apply it on a larger scale?
Well, now that's where things get really exciting.
Okay.
Imagine a world where every hospital,
Okay.
from major urban centers to those remote rural clinics,
Yeah.
have access to this AI-powered early warning system.
I'm imagining it.
Yeah.
It feels big. Like, what kind of impact are we talking about here?
Well, for starters, think about the global healthcare staffing crisis.
Oh, right.
We're short doctors. We're short nurses.
Everywhere. Yeah.
All over the world.
Yeah, that's true.
And the ones we do have
Yeah.
are often overworked and completely stretched thin.
Right. And burnout is a huge problem, too.
Huge.
It makes sense that having a tool like this could help alleviate some of that burden
Yep.
and prevent some of those mistakes
Absolutely.
before they even happen.
By having that extra layer of support,
Yeah.
ChartWatch can really free up those human medical professionals
Yeah.
to focus on what they do best,
Right.
providing that compassionate, personalized care to their patients.
It's like giving every doctor and every nurse a superpower.
Yeah.
The power to anticipate and potentially prevent
Mm.
these medical emergencies before they even arise.
It's incredible.
It is incredible.
Yeah?
But what about the cost? I mean,
Yeah.
something this advanced can't be cheap.
That's a really valid concern.
Right.
But consider this. How much does it actually cost to treat a patient in the ICU
It's true.
for a week?
Yeah.
Or the cost of long-term care for someone who's experienced a preventable complication?
Whoa. Okay, you're totally right.
Yeah.
If this technology can help hospitals avoid even a small number of those cases,
Right.
the cost savings could be enormous.
Absolutely.
And more importantly, countless lives could be saved.
Exactly.
It really makes you think when you put like that, you go to the hospital, you kind of expect that level of care.
Right.
But you also want that peace of mind that there's something
Yeah.
watching over you, catching those things that maybe humans just miss sometimes.
Exactly. And that's what's so fascinating to me about this.
Yeah.
It's not about replacing that human judgment.
Yeah,
It's about making it even better with AI,
absolutely.
giving those doctors and nurses the tools they need to make the best possible decisions.
I love that we're not talking about robots taking over the hospital.
Yeah.
We're talking about using this advanced tech to support the incredible work that healthcare professionals already do every day.
Exactly.
This deep dive into ChartWatch has seriously opened my eyes to the potential of AI in healthcare.
It's definitely an exciting time to be paying attention to this.
Right.
And while there will always be challenges
Of course.
with any new tech,
Right,
right, especially when we're talking about something as important as healthcare,
right.
but I think we're at this point where AI is here to stay,
Yeah.
and the potential benefits are massive.
Well said. On that note, I think we'll wrap up this deep dive.
Sounds good.
We've covered a lot of ground today and learned a ton about this groundbreaking AI
Me too.
that's already saving lives.
Yeah.
What are your final thoughts?
You know what I think it all boils down to? This amazing, we all want the best possible care for ourselves and our loved ones, right?
Uh-huh.
And AI, like ChartWatch, it's not just about numbers and algorithms.
Yeah,
It's about giving people a fighting chance.
it's about hope.
Exactly.
I love that. Well said.
Thank you.
As always, thanks for listening, everyone.
Yeah, thank you.
And we'll catch you on our next deep dive.